Okay, so Bob, are you ready? Should we get started?
Yes, I'm ready. Okay.
Great, thank you. Well, welcome everybody. Thank you very much for coming. We're going to be talking in tonight's webinar about working with GPs and how we can support you to work with your GPs. I'm Lizzie Mills, the Director of Postgraduate Studies at CPD for All.
I'm Jackie Kinsey, and I'm the Senior Teaching Fellow at CPD for All.
Bob, would you like to introduce yourself?
Yeah, I'm Bob Saunders. I'm a prescribing advisor for Walsall CCG and also a teaching fellow in prescribing at Keele.
Thank you, Bob. So we're going to start telling you a little bit about CPD for All, and then we'll talk about working with GPs and working with prescribers. We'd encourage you all to tweet using the hashtag CPD for All. So please do make your comments and tweet as we're going along. If you have comments and questions that you'd like to ask, that you'd like us to address in this webinar, there is a chat box in the bottom right hand corner there, and you can type your questions and comments in the box and we will respond to those. So who are we? Well, CPD for All is the Centre for Professional Development and Lifelong Learning, and we were originally established in 1994 as a department within Keele University with a unique mission to provide postgraduate education for pharmacists and other health professionals whose role is central to prescribing and the use of medicines. And over the last 20 years, we've built strong links with the NHS and employers, and we have a national and international reputation for delivering postgraduate education through distance learning and work-based learning. The School of Pharmacy at Keele was established in 2005, and we became a centre of excellence within the school, and our growing reputation has led to the formal development of the centre and hence the launch of the Centre for Professional Development and Lifelong Learning, or CPD for All. And what do we do? Just to set the scene so you know how we work and what we can offer you. We've built our reputation on the provision of distance learning courses that support your professional development. All our courses are provided online, meaning you can study wherever and whenever suits you. There's also flexibility in what you study and how you choose to approach the courses. You can choose to register for a certificate or a diploma award from the outset, or to register for one module at a time and build up credits towards an award. But of course, you don't have to study towards an award. You can choose just to study one module with us if it meets your own professional development needs. So all our modules are designed for practicing healthcare professionals, and we've developed them to encourage you to put your learning into practice and to reflect on your development. And we do this through the use of learning activities within the modules, such as practice spotlights and work-related assessments and projects. And if you do study a course with us, you'll be asked to keep a reflective portfolio for most of our courses, and this is where you can really demonstrate and reflect on your development. We have a dedicated postgraduate team with expertise in supporting distance learners. This includes administrative and IT support. We provide you with written material and podcasts to get you started, and a dedicated induction programme, guides to all the IT systems. We're always at the end of the telephone or an email, and once you get started, we provide detailed feedback on your assessments to help you to develop, and we receive many comments about the high level of support we provide from both our students and our external examiners. And finally, very few of our courses contain compulsory elements, and we offer the options for you to choose the modules that best suit your learning needs and to build your own pathway to a postgraduate award to meet your own particular learning needs. And we have a course builder on our new website, which enables you to choose the modules from different programs and build up your own pathway to an award. So I would encourage you to have a look at that. So if we move on to working with prescribers, I thought I'd wanted to just sort of set the scene a little bit about the work that we do with prescribers and training people to work with prescribers. So we've been training pharmacists to be prescribers since legislation first allowed in 2004, and we were also among the first to provide an independent prescribing conversion course. And a Keele graduate was the first pharmacist to qualify as an independent prescriber in the UK in January 2007, and since then in the region of 200 pharmacists have qualified as independent prescribers with Keele. And the independent prescribing preparatory course can be incorporated into all of our postgraduate awards. We've been providing short courses and postgraduate awards to support pharmacists working with prescribers for many years through our prescribing studies programme. And many of the pharmacists who've studied on our community pharmacy programme have gone on to work closely with their local GPs. In 2011, we were commissioned by some local PCTs to train a group of GPs to become GPs with special interests. So we have a proven track record of working with prescribers and of training pharmacists to work with prescribers. And now I'm going to hand over to Bob, who's going to talk a little bit about what it's like to work with prescribers from his personal experience and from his research.
Okay, good evening. Pharmacists working with doctors is not a new phenomenon. It is a natural part of the dispensing process and has been commonplace in hospital for many years, sort of thinking of in terms of medicines information and clinical input to patient management. In the early 1990s, some health authorities pioneered community pharmacists working with GPs, and by 1996 funding became available from prescribing budgets to develop practice pharmacist teams, with numbers of practice pharmacists in the West Midlands increasing from 16 in 1995 to 66 in 1997. So that was some research that Alison Blenkinsop did at the time. I know that in fact in 1994 there was at least one non-dispensing pharmacist, as they were described, working in the West Midlands, and they were part funded by the GP, part funded by the CCG, and their role was beginning to become advanced, and in fact they moved on to anticoagulant disease management. And at the time they quoted, the doctor that wrote the letter to the BMJ quoted, "We have moved beyond mere cost control to tackle the real issues of rational prescribing, safe, effective, available and acceptable to the patient. All of us in the team, including patients, find their," that means the practice pharmacist's, "role invaluable." In 1998, the MPC and NHS executive summarised models of how pharmacists could contribute to medicines management in a document called GP Prescribing Support, a resource document and guide for the new NHS. And this includes examples of brown bag and domiciliary medication review, post-discharge medication counselling, audits of medication in care homes, disease management. At the time, anticoagulation and pain control were quoted. Therapeutic and financial updates, formulary development, repeat prescription management and prescribing data, which you can compare with what we're going to say later on is going on at the moment. Quite interesting. The rationale for introducing pharmacists into practice at the time were to contribute to the effective treatment of patients with medicines and maximising the safe use of those medicines, to ensure best value for money from an expensive resource, to ensure that patients receive a comprehensive and consistent package of care wherever they are, and that there's proper continuity when patients transfer between home and hospital, which is still an issue today. Practice pharmacists were defined at the time as a pharmacist who works with primary care physicians and patients to enhance the quality of prescribing and use of medicines and to contribute to the resource management of medicines. There have been some recent developments. One of these is that primary care is facing an immediate crisis of falling workforce and rising demand. That's been in the news. And there are a significant number of registered pharmacists available with underused skills that could play an important role in helping GP practices and primary care providers fill gaps in service provision quickly, practically and cost effectively. And the evidence for this is that pharmacists working in GP practices have provided improvements in care provision and working patterns, and patients are comfortable with pharmacists working in general practice. Prescribers have many sources of medicines information, and these need to be digested, prioritised and disseminated, and practice pharmacists are ideally placed to lead on this for the practice team. Similarly, where it comes to financial restraint in terms of cost of drugs, they can also lead on managing the cost of drugs in the practice and provide information about where the money is being spent from EPACT and other sources. However, there does need to be some further definition of the role and subsequent assessment of the training needs required. And other issues include the need for clarification, such as managing conflicts of interest and also indemnity issues. So I got started by applying for a practice pharmacist job with the PCG at the time in 1999. Seems like a long time ago. Practice pharmacists were fairly new then, but we had a health authority with a very proactive pharmaceutical advisor who had the vision to build up the practice pharmacist team. I must confess it was a bit odd and daunting at first, but when I started, we did simple things like generic switching and gradually began to understand how GP practices worked, what they needed from us as a pharmacist and what we could contribute. I sort of grew into the role, as did a lot of other people at the time, and I completed the diploma at the same time, which was very helpful in cementing my understanding of what was needed. And it wasn't very long after that I had my first sort of real contact with patients in a GP situation, and for a long time I had a weekly joint CHD clinic with a nurse, and that really taught me a lot about how to deal with patients in a one-to-one situation, or in a one-to-two situation as it was there, and gave me insight into the necessary skills that were required to look after patients in that situation. And of course, once supplementary prescribing became a reality in 2003, I jumped at the chance to have a go. If you want to start as a practice pharmacist now, there are a number of organisations that host practice pharmacist teams at the moment. Some of them are clinical commissioning groups, the CCGs, that one that I work for does. There are the commissioning support units. They also have pharmacist teams which they supply to certain CCGs. Some acute trusts actually host the practice pharmacist team on behalf of the CCGs, and also private providers. There are some pharmacists that are directly employed by GP practices, and I think this will include or increase as groups of practices federate and combine together to provide a wider service. I think that provides an opportunity for pharmacists to get involved. In both cases, NHS Jobs and the Journal are good places to start looking for these jobs. If you're a community pharmacist and want to think about providing a practice pharmacist role from your pharmacy, you could start by building relationships with your local practice and start to liaise on things like, or liaise more closely on things like MURs, minor ailments, smoking cessation, weight management, care homes, palliative care and substance misuse. And also you might start to consider medicines reconciliation, particularly after discharge, which is when patients are vulnerable, and that can be linked to the new medicine service, of course. Also, there's a role for community pharmacists to work closely with practice on practice staff training, so they understand some of the nuances of the NHS and how prescriptions are processed and what happens to them, about prescription charges, which is often confusing for the patients and practice staff. Also, you can provide medicines information, which you do anyway as part of the dispensing process, but perhaps also advise on stock shortages, which also is part of the dispensing process, and side effects and monitoring if that's what the practice would like. And I've mentioned care home services before. I think that you can see how the relationship develops, and then you can decide whether you or yourself are going to provide that practice pharmacist, or whether you're going to buy in a pharmacist to work more closely with practices, or a mixture of both. It's about seeing what's needed and how you develop that relationship. So what do practice pharmacists do? I've just listed some of the things on the slide here, which I've mentioned already, a lot of which I've mentioned already. But if you want a more comprehensive view of what pharmacists do, then there's an excellent blog written by Ravi Sharma, who's also appeared on BBC TV and I think Channel 5 as well, on what pharmacists do in a GP setting. And many of the things that he mentioned are mentioned on here as well, on this slide as well. What do I think you need to be a PP, practice pharmacist? I think there are a number of competencies that you need. Some like communication, interpersonal and time management skills are taught at undergraduate level now, and also you've probably honed them in practice. Others need to be gained either from experience or training. In my view, it's essential to understand how primary care works and general practice works in order to have a shared understanding of the issues and be able to problem solve for them and support the GP team. I think it's also essential to have a commitment to CPD, because the role is still being defined and refined, and it will inevitably grow to include new areas or levels of practice, which will require the practice pharmacists, in-house practice pharmacists, to gain new competencies. And a good example of these are health assessment skills. PPs, well, practice pharmacists, sorry, I'm using the abbreviation, apologise, will probably lead on medicines issues in the practice. So you'll have to be able to find, understand and communicate potentially complex medication issues too, and answer queries from the rest of the GP practice team. And of course, patients. Much as what is said above is in the Royal Pharmaceutical Society General Practice-Based Pharmacist job description, which is available online. Whilst it's not yet clear what PPs will require to have it as formal qualifications, the ability to study at a postgraduate level is as likely to be a requirement than is necessary for the prescribing qualification, which is extremely useful in terms of saving time for the GP and as convenient for the patient. As part of a wider study, I have recently surveyed 49 practice pharmacists in the Midlands, and of these, roughly a quarter had a higher degree, 69.4% had postgraduate diploma, and 82% had a prescribing qualification. Some obviously had more than one, to give you numbers that don't add up to 100, add up to more than 100%. GPs interviewed in the same area thought that their practice pharmacists were adequately trained for the role that they currently undertook, suggesting that this level of education is about right. What are my personal experiences of working with GPs? Well, challenging, rewarding, it's a team role, it's a clinical role, and you are appreciated for what you know rather than what you do necessarily. Every day is different, and as a result, you learn something new. As a bonus, you'll never be sure things to write up as CPD or put in your faculty portfolio. You can actually make a difference on a day-to-day basis to patient care, either individually, face-to-face with patients, or as a whole through some medicine safety or other intervention that you make. It's important to remember you're part of a multidisciplinary team. It works when you support them and they support you. And I think above all that, it's a clinical role in primary care, so an opportunity to use clinical skills. You will certainly be appreciated for your unique set of competencies, and just to back that up, most of the GPs that I interview, and virtually all of them that I speak to, have see the value of a practice pharmacist, those ones that have got one, see the value of a practice pharmacist more or less at all the levels at which they work. In terms of opportunity, direct employment by GP practices or groups of practices is really burgeoning now, and there are more and more adverts out there. So it's time for the profession to move forward in this direction, I think. Okay, Jackie, over to you.
Hello everyone. So I'm really going to talk about how we can support you to work with GPs and talk a little bit about the courses that we offer at CPD for All. So for those pharmacists wishing to work with GPs but are unsure of their skills, Keele offers several modules that are highly relevant to the role and will give you a strong base from which to progress. Most pharmacists will probably be working and will have to manage their learning time within a busy week, and flexible distance learning is a practical way of achieving this. And CPD for All has got a lot of experience in supporting the student with flexible distance learning. There were two aims of the joint statement that you may have seen recently that came out from the Royal Pharmaceutical Society and the Royal College of GPs for pharmacists and GPs to collaborate more closely over patient care. The first aim was calls for community pharmacists and GPs to collaborate on patient care for practices, local commissioners and NHS England to make better use of the skills of local pharmacists in the community when addressing patients' pharmaceutical needs. The second aim is for pharmacists to work as part of the GP practice team, making use of their expertise around medicines to better address pharmaceutical care, reduce medicines waste, and free up GP time to focus on more complex cases. These roles, as Bob has already pointed out, are not new, but the call is for this way of working to become the norm. So how do you make sure you are prepared to seek out these opportunities? This slide shows just a small selection of the short courses that we can offer that may help you. So we offer working with prescribers in primary care, patient-prescriber partnerships in medicine taking, building working relationships with the advanced practitioner, rational prescribing, prescribing and financial information for practices. And we have a lot of modules which look at different therapeutic and clinical areas such as hypertension and asthma. We also offer the independent prescribing course and modules like communication and consultation skills. You can find out more information of all of these courses from the web link at the bottom of this slide. If you wanted to take your studies further, then you could mix and match some of those modules that you saw on the previous slide and build them up into a diploma award. For a diploma award, you need 120 credits. Our independent prescribing course is 60 credits, but within the prescribing study program, we have 3 themes. The first theme is principles underlying rational prescribing, and that includes modules such as pharmacology and biochemistry, treating individual patient groups, hazards of drug treatment, and monitoring drug treatment. We have rational prescribing, and a theme that's some practical considerations for prescribers, where you might think about things like ethical issues in prescribing or the patient-prescriber partnership. I say by choosing different modules from this, you can build up another 60 credits, and that will give you the 120 credits that you need for your diploma award. If you wanted to look at our community pharmacy diploma, again, you can mix and match different modules, and here is the selection of modules that make up our one of our pathways to the community pharmacy diploma, and that would be to take the working with prescribers in primary care module at 15 credits, promoting health, communication and consultation skills, building working relationships for the advanced practitioner, and developing and delivering high quality services. Again, you could add in clinical modules, so if something like angina or joint disease or asthma, COPD or something like that was of interest to you, you could choose those different modules for another 15 credits. If you added in the independent prescribing course, which as we've said previously is a 60 credit module, again you'll have accrued enough credits to obtain your diploma award. An increasing number of pharmacists are now working directly with GPs in primary care, undertaking a number of roles. And with recent announcements, it seems likely that these opportunities will increase in the future. We did have one student who went on to do a diploma award, who was a community pharmacist, and then she went on to talk more about her role within GP practice, which she was able to do by getting her diploma award. She said to us that it was something that she had not envisaged doing, as she'd only previously worked in community pharmacy, but she took on an additional part-time role as a practice pharmacist to support implementation of the CCG's Prescribing Incentive and Medicines Management Scheme. She completed the first 3 modules towards her diploma award, and that gave her the confidence to try something new and enabled her to make use of the skills that she'd developed in a different working environment. She chose the Working with Prescribers in Primary Care module to help her gain additional skills to help with her new role. As she'd always worked in community pharmacy, her knowledge around the current structure of the NHS was limited, And she found that as she worked in GP practice, it was essential for her to have an understanding of how general practices fit into the NHS structure and how they were funded. And that is something that Bob alluded to a little while back. This student also felt that to be able to influence prescribing decisions, it was necessary to have an understanding of how those decisions were made by GPs and the factors affecting them. Learning about those helped her reflect on how she made decisions when advising patients in the community. I think studying the rational prescribing unit helped her to understand why a GP might change his prescribing behaviour. And she used the knowledge that she gained to have conversations with GPs about how to change their prescribing practice and how to support them to meet CCG prescribing incentive schemes. Although this student started off with limited medicines management skills, she's told us that she is learning as she goes, and she's learning about guidelines, and she's trying to implement an evidence-based approach. And again, she found that our evidence-based practice module helped her with this and gave her the tools to become quite successful in implementing evidence into practice. The clinical knowledge and IT skills she developed during her first two modules also gave her the confidence to try out her new role. And she's used her experience on the diploma by building up communication and team building skills to really develop her role in practice. And this student has put a testimonial which you can read for yourself on our website. So finally, I just want to go on to thank you for listening to us tonight, but also to let you know that on Monday we will be talking a bit more about how you can become a prescribing pharmacist, and we'll be talking about what you need to do to apply for our independent prescribing course, but also to give you a bit of background about what the course involves, so that you can prepare yourself if you want to take on this role. Lizzie, would you like to say anything further at the moment?
No, just thank you everybody for attending. Has anybody got any comments or questions that they would like to ask about what we've just talked about? If you do, please do type them in the chat box in the bottom right hand corner. Just give it a moment to see. Would you have a question being typed, I think, at the moment? So we'll just wait for that to come through. Okay, yeah, so Sarah, I'm very pleased that you've just completed your first webinar, and thank you for joining us. I hope you found it a simple process to join us. Amy, you've asked, when can I start the Working with Prescribers module? And that's a very good question, actually, and something we probably didn't address. Most of our modules, including this one, are ready for you to start whenever you want. So all you need to do is get in touch with us and apply for the module, and you should be able to start it pretty much straight away. Wendy has asked, how long does it usually take to get one of your awards? Jackie, do you want to answer that?
Well, the independent is 60 credits, is a 6-month course. If you want to gain a certificate award, normally we say that it is an academic year, so it is about 9 months. A diploma would take you two academic years. So yeah, two academic years. So, but you can take up to 5 years to do them, and because we do offer this sort of mix and match way of studying, you could, for example, do a 15 credit course over a period of say 2 or 3 months, and then take a month off, go on holiday over the summer, and then come back to us. So there are some timelines, but as long as you have finished the whole program that you're after within 5 years, then you have got a lot of flexibility.
And we usually give up to 6 months for people to study one module. So you can obviously choose to submit assessments and study it in a shorter amount of time, but up to 6 months is our maximum. And then, as Jackie said, up to 5 years to complete an award, but you can do it quicker if you want to. We're very flexible. Are there any other questions?
Come on, Anthony, you've always got a question for me.
Maybe not tonight. Oh, there he is. So Anthony is just typing a question. We'll just wait for that to come through. Yeah, good question. Well, good question, Anthony. So Anthony's written, thank you. I missed the first 15 minutes or so. Will you be repeating the webinar? Well, we are actually recording the webinar and we will post it on our website tomorrow. Actually, it will be on the link that's showing on the screen at the moment. So cpdforall.co.uk/events/. And so you will be able to see a recording of the webinar. And yes, I'm sure we'll repeat it at some point over the next sort of few months or so, and we will advertise when we're doing that.
And it's the same. I mean, some of our webinars we're doing at lunchtimes and some we're doing it in the evening, and we appreciate that not everybody is going to be able to, make a lunchtime meeting. So if you are interested in any of our lunchtime ones but can't join us at that time, then you will be able to get them off the website, I say, as they will all be recorded.
Yeah, and it will be going on the website tomorrow. This week. And in fact, you can actually catch up with the first webinar that we did last week, and that's already on the website. So Amy has asked a question. Roger. Could we complete the 60 credits in infectious diseases?
Roger, the maximum number of credits you can get on a CPD course is 30 credits, but for example, you could do say 15 credits in infections. It depends what your area of practice is. We have an HIV module, so there are other smaller modules that you could maybe do at 10, 15 or even 30 credits to build up a sort of infectious package, really. So, if that's something that you're interested in, then give us a ring or email us, and we can talk about it in more detail.
Yeah, or you can contact us through the website. There is a page there for you to type your query, and it will contact us. Amy has asked, can you complete the Working with Prescribers module if you're currently a hospital pharmacist? That's a good question. The module is actually aimed at pharmacists who are working in the primary care sector, so community pharmacists and primary care pharmacists. But there are other modules around sort of communication skills and working with prescribers that would be part of our clinical pharmacy, hospital pharmacy portfolio of courses. So do contact us again if you've got particular learning needs around that and you are a hospital pharmacist. Do contact us and we can talk to you about that. Any more questions? Okay. Well, thank you very much, everybody, and thank you for listening. Thank you for giving up your time. We hope you found it informative and useful. Thank you for your questions. Do tweet about us, please, and tell your friends about us. Do go and have a look at our website and join us for our next webinar on Monday. Thank you very much.
Thank you and good night.
Good night.
Oh, hang on a minute. Anthony's typing.
Anthony's typing. Oh, thank you.
Thank you, Anthony.
welcome.